Welcome to the eye department at St Mary's Hospital. The following video has been developed to inform you about your impending cataract operation. You will have an opportunity to discuss this with a member of the nursing and the medical staff before your operation.
Cataract surgery was first performed in a very primitive way hundreds of years ago. Even up until the last 20 to 30 years, patients were admitted to hospital for several days. They were unable to return to normal life for weeks following the operation. Today, cataract surgery has been developed into a quick and sophisticated form of restoring sight. But not everyone that comes into the cataract clinic will require surgery. Generally, the procedure is performed on a day-case basis, with a hospital stay of around 4 hours. Return to your normal lifestyle is almost immediate. We perform cataract surgery on over 1,000 patients a year, but this figure is set to rise with the increase in growth of individuals over the age of 65. This diagram shows the side view of the eye. The lens is normally transparent and situated behind the iris and the pupil. A cataract is simply a clouding of the lens caused mainly by the aging process. There are other conditions that can cause cataract formation, such as diabetes and the use of certain drugs like steroids. The operation is designed to remove your lens and replace it with a clear plastic implant, which is done by making a small cut around 3 to 4 millimeters on the top of the eyeball. An ultrasonic probe is inserted through this cut, which breaks the lens down into fragments. These are then removed. The outer shell or capsule of the lens is left intact to protect the delicate tissues at the back of the eye, and also provide support for the implant. Once this process has been completed, a new lens is inserted. It might be necessary to place a stitch in the eye to seal the initial cut. All of this takes just 10 to 15 minutes.
We're going to do the vision test now, so holding this little gadget over your nose and looking at the letters on the chart, tell me what you can read using your distance glasses.
A, O, E.
Charles has a cataract and is here for his first assessment before his operation. The assessment process involves measuring and checking your vision and general health.
I'd like you to look up to the ceiling for me. That's lovely. Keep looking up. That's super.
Your eye will be dilated before you see the surgeon. These drops will wear off in a few hours. We also like to make certain you're aware of what will happen to you before, during and after your operation.
I think that if you had the cataract operation, there's every chance that your vision would be improved by the surgery, all things going well. And all things go well most of the time with cataract surgery, but just as in any other operation, there's always a small risk of things going wrong. And they can either go wrong during the surgery, or they can go wrong in the way the eye responds to having had an operation done to it. But the vast majority of cataract operations go entirely according to plan.
On average, 1 in 100 cataract operations suffers a significant complication, but many of these can be corrected with further treatment. They include endophthalmitis, capsular rupture, vitreous loss, dropped nucleus, retinal detachment, and cystoid macular edema. Overall, there is a 1 in 1,000 risk of a complete or partial loss of vision as a consequence of cataract surgery. Okay?
During the assessment, you'll be taught how to apply eye drops correctly.
I'm going to show you on myself the best way to use it, but there are several ways. So there's a little valve in the neck of the bottle which allows just the one drop out. So if you hold it in your thumb and third finger and press on the base, you can get one drop out like that. Okay? So after you've washed your hands, holding the bottle like that, pull down the lower lid, lean back, and gently place above the eye, looking up, and then press once on the base, and the drop should go in. Some patients have difficulty doing over the eye method, but you can use the bridge of the nose just by gently placing it over the bridge, looking up, and again pressing the base.
These drops will be necessary after surgery, and you'll be given the chance to practice with a nurse present.
Right, Mr. Carter, I'm Sarah and I'm going to do some measurements on your eyes today, all right?
Generally, our measurements are calculated to restore a level of sight that is good for middle and long distance, but will require you to have reading glasses.
What we need to do is get your chin on the chin rest. Okay, I'm going to pull you forward. That's it. Just keep looking straight at the little light there. Brilliant.
For those of you who are short-sighted, which means you need glasses to see in the distance, we can insert an implant that will correct this. Again, reading glasses will be needed after surgery.
Now, Charles, we've got a little booklet called Cataract Surgery here, and you can have a little read of that if you're able to with your dilated pupils. So any questions that you think of, you can always check, because most of what we say is in this booklet. All right?
Yes, thank you.
Having completed your eye assessment, you will then go down to the pre-assessment unit for your general health check.
Okay, just rest your arm down and relax. Pop this on your finger for your SATs.
We will need to know if you are taking any tablets that thin the blood. These include aspirin, warfarin, dipyridamole, clopidogrel. Also tell us if you take the prostate tablet, tamsulosin.
Normally, you'll be asked to arrive on the ward about an hour or so before the predicted time of your operation for your dilating drops. You'll have been advised by the pre-assessment unit about eating and drinking. For local anaesthetics, there are no restrictions on the food. However, we advise only a light meal before surgery.
You have 4 sets of those drops over about 1 hour, and then we'll take you into theatre.
I see, yeah.
When you're in theatre, we put some more drops into your eye, which are numbing drops, and then one of us sits and holds your hand throughout the procedure. Okay?
Thank you.
And so if you want to cough, sneeze, then it's very important you squeeze the nurse's hand if you want to cough or to stop the surgery in any way.
At this stage, there can be a wait when transferring you to the operating theatre to allow the drops time to work. You'll normally walk or you can be wheeled in a chair, but we do like to wheel you back after the surgery.
You understand what we're going to do today?
Understand.
We're going to do the cataract operation on the right eye, just as we discussed in the outpatient clinic. All right. So we're going to take the cataract out of the eye. We're going to put a small plastic lens inside to replace the cataract, and the plastic lens stays there forever.
Oh, that's
All right?
Yes.
Okay.
Thank you for letting me know.
That's okay. And this is the eye that you want done today, the right eye?
Yes.
Okay,
That's
fine.
correct.
All right.
Once in theatre, you'll be asked to sign a consent form to give us permission to perform the surgery. Then your eye will be numbed by either an injection into the skin at the bottom of your eyelid or by drops applied directly into your eye. Shortly after that, we will lay you flat on the operating trolley. Your head is supported in a special rest. If need be, we can raise your head slightly. The trolley will be bent under your knees to increase your comfort during the operation. The skin around your eye is cleaned, after which you'll be covered with a plastic drape, which will have cool air piped under it during the surgery. You will need to remain quiet and still while the procedure is carried out. A nurse will hold your hand, which you're asked to squeeze if you need to speak with your surgeon. Some people are worried that they might see the operation or blink during the surgery. A device is used to keep the eye open, and the most you might see is bright coloured lights. The equipment in the operating theatre is quite noisy, so we'll generally aim to play background music for you during your operation. Once completed, your eye is covered with a plastic shield. You'll be helped to sit upright and then transferred back to rest on the ward, where you'll be offered a cup of tea and biscuits. You'll now be asked to rest for about an hour, after which we'll check your eye and discuss the aftercare with you.
Okay, now the eye looks good, the pupil's still very dilated, so just be aware that it can just affect your judgment with steps and stairs and things like that.
After surgery, you'll be able to do normal activities apart from strenuous heavy lifting, sports, gardening and swimming.
So this shield's going to go back on now. You will need to buy a reel of this
I've
tape. You've
I've
got some.
already. I
Just to
also
keep.
bought one of the eye things.
That's good.
It's important that you understand what you need to do to look after your eye.
So you've got put one drop into the right eye 4 times a day.
Yes.
They're antibiotic, anti-inflammatory,
Yes,
and then you have a spare one
yes, just
as
in
well.
case. Yeah.
Each of these bottles should last 2 to 3 weeks. Continue taking them until you're advised to reduce them at your follow-up appointment. Cataract surgery remains one of the most successful operations performed today and has improved the sight of thousands of people here on the island.